Welcome to Exam Sale. This short guide walks you through the NCLEX-PN test plan so you know what to study and why each area matters. Overview of the NCLEX-PN blueprint and domain weights. Coordinated care 21%, safety and infection control 13%, pharmacological and parenteral therapies 13%, psychosocial integrity 12%, reduction of risk potential 12%, basic care and comfort 10%, physiological adaptation 10%, and health promotion and maintenance 9%. Each domain is assessed with scenario-based items, and the estimated study time varies by domain. Coordinated care is 21% of the exam, classified as hard, with an estimated learning time of 40 hours and scenario-based assessment. You will learn client rights and ethics, including recognizing ethical dilemmas, respecting autonomy, advocating for client preferences, verifying informed consent, and maintaining confidentiality and advanced directives. You will also master assignment, delegation, and supervision by applying the 5 rights of delegation, identifying tasks for UAPs, supervising delegated tasks, assigning care based on competency, communicating care needs, and prioritizing based on acuity and safety. Safety and infection control is 13%, medium difficulty, with about 25 hours of study and scenario-based items. Expect to learn accident and error prevention such as fall risk factors, seizure precautions, body mechanics, to identifier verification, and maintaining a safe environment for confused or high-risk clients. You will also study infection control and surgical asepsis including standard and transmission-based precautions, correct use of PPE, maintaining a sterile field, and safe handling and disposal of hazardous materials. Pharmacological and parenteral therapies is 13%, hard, and requires roughly 45 hours of study with scenario-based assessment. Focus areas include medication administration skills like the 6 rights, dosage calculations, oral topical and parenteral routes, IV infusion monitoring, client education, and documentation. You will also learn pharmacological actions and adverse effects by monitoring therapeutic effects, identifying and reporting toxicities and contraindications, managing pharmacologic pain interventions, and recognizing drug interactions. Psychosocial integrity is 12%, medium difficulty, with an estimated 20 hours of study and scenario-based questions. You will assess coping mechanisms and mental health by evaluating responses to stress, spotting maladaptive coping, supporting grief, using therapeutic communication, caring for psychiatric needs, and identifying substance abuse behaviors. The domain also covers abuse, neglect, and crisis intervention including screening for abuse, mandated reporting, suicide risk assessment, implementing safety measures, and connecting clients with resources. Reduction of risk potential is 12%, hard, with about 35 hours of study and scenario-based items. You will learn diagnostic tests and lab value interpretation by comparing labs to reference ranges, notifying providers of critical results, preparing clients for procedures, monitoring post-procedure complications, and interpreting routine blood and urine tests. You will also focus on changes in condition and vital signs by trending vitals, performing focused assessments, recognizing deterioration, preventing post-operative complications, and assessing neurological and cardiovascular changes. Basic care and comfort is 10%, easy, and requires approximately 15 hours of study with scenario-based assessment. Expect practical skills in mobility and restorative care such as assessing range of motion, using assistive devices for transfers and ambulation, preventing skin breakdown, performing ROM exercises, and positioning for comfort. Nutrition, hydration, and elimination topics include monitoring intake and output, maintaining therapeutic diets and fluid restrictions, managing enteral nutrition and tube feedings, implementing bowel and bladder training, and assisting with toileting and hygiene. Physiological adaptation is 10%, hard, with an estimated 35 hours of study and scenario-based questions. This domain trains you to manage acute and chronic conditions by recognizing respiratory distress, providing emergency cardiac care, managing fluid and electrolyte imbalances, identifying shock or sepsis, delivering wound care and monitoring healing, and assessing for unexpected responses to therapies. Strong pattern recognition and timely interventions are emphasized. Health promotion and maintenance is 9%, medium difficulty, and takes about 20 hours of study with scenario-based evaluation. You will study developmental stages and transitions by assessing growth and milestones, caring for pediatric and adolescent clients, recognizing aging changes, performing health screenings, and teaching immunizations and prevention. Maternal-child topics include prenatal education, fetal heart rate and maternal assessment, postpartum care for mother and newborn, breastfeeding education, and identifying pregnancy or delivery complications. Wrap up by making a study plan that uses the suggested hours and focuses on the highest weight domains like coordinated care at 21%. Practice scenario-based questions, review lab values and medication calculations, and prioritize delegation, safety, and emergency responses. Good luck on the NCLEX-PN and study smart with targeted practice and steady review.